textbooks, dermatology, primary care. Throughout our lives, we will all interact with the healthcare system. So, what happens when that system is not designed with certain groups of people in mind? As a Black person in America, I have experienced firsthand racial disparities in healthcare. The turning point for me came during the pandemic when at a local clinic, I was asked if I had a red rash on my skin. At that point, it dawned on me that some healthcare professionals did not realize that skin rashes do not exhibit the same way on different skin pigmentations. If something so obvious could be so casually overlooked by a healthcare professional, what other elements of care, treatment, research, and education are also being ignored, and what does it mean for people of color using this healthcare system? I am Vivian Kopsinger-Birchall, and in this series, we will take a closer look at disparities in healthcare, speaking with medical professionals and hearing personal stories to get a better understanding of those disparities and explore ideas and strategies for how to bridge the gaps.
Global health conversations continue, and I am with Mahlet, who is going to introduce herself, tell us a little bit about herself, what she does, and maybe why you're here today.
Yes, I'd love to. So my name is Mahlet. I went to Penn for undergrad, where I studied health and societies, and I concentrated in public health with a minor in Africana studies, so focusing on racial health disparities, social determinants of health. That's what I did for my 4 years there. And then I just finished my MPH at Dartmouth, at the Dartmouth Institute for Health Policy and Clinical Practice. I focused in community health, global health, racial health disparities as well. So yeah.
And what brings you to the Global Health College today?
So I'm actually presenting on my research, looking at the effectiveness of the interventions that were utilized in the 2014 Ebola outbreak in Guinea, Liberia, and Sierra Leone, and just lessons learned and thinking about how we can create an equitable path forward.
Oh, speaking of that research, what can you tell us about your findings in that Ebola research, and maybe even how was it funded and why did you choose that?
Yeah, so I chose it just because of my passion in public health and global public health equity. My other research looks at equitable COVID vaccines for LMICs and for low-middle income countries. And so this I was really passionate about just because I've been doing research on the side, and I was able to conduct it over the course of 9 months. And I'm really interested in structural and historical causes of outbreaks, and thinking about how we can understand those structural and historical causes to understand the upstream root causes of why things progress the way they are.
So you said you're making a presentation today. What will that presentation entail?
So the presentation will just kind of look at my research, kind of understanding the interviews that I conducted with first responders. So I looked at interviews with MSF, Doctors Without Borders, IMC, the International Medical Corps, and CP, the Coalition for Epidemic Preparedness Innovations. And so I conducted those interviews with people who were on the ground, whether they were clinicians that were responding in the 3 countries or folks at IMC who were doing more of the educational directing side of things and creating the protocols for clinicians and just understanding their experiences. Of course, it was a huge time of great uncertainty, so it's always easy to look back and say, okay, we could have done X, Y, Z, but everyone's kind of scrambling with the resources available. So just taking a look at that,
Yeah, and how does it tie into this whole global health conversation happening today?
Yeah, well, I think we just listened to one of the student presenters talk about the issues with the global north and the global south, and thinking about the power differentials that have been present historically and also present day manifesting. So when we think about our interventions, it's really important to think about these legacies, whether that's colonialism that have present day impacts or different power differentials that are the reasons and the root causes of why we are in the situation we are today. That's why we tailor our interventions to address that and get as upstream as possible so that we don't do bandage fixes, in my opinion.
Oh yeah, I love that. Don't do bandage fixes.
Yeah, no bandage fixes.
Right, and so do you do some work with Johns Hopkins still?
No, not yet.
Not yet,
I'm actually talking to Rivka.
Okay.
Yes, but not yet.
Not yet.
Yes.
All right.
Yes.
So anyway, what are some of the moments that have stood out for you in so far in the conversations we're having?
I really loved our conversation on health technology and AI. It's a field that I'm not super knowledgeable about, but it was really interesting because I am passionate about AI and the intersection of that and health. And I liked how we talked about patient-centered health and thinking about that ties into something that I talked a lot about in my MPH program, which is this concept of health co-production and having the whole team, like a holistic perspective, co-producing health outcomes instead of having this hierarchical nature where you have, okay, doctors prescribing XYZ patient plan and us just, and patients just kind of following that. So thinking about this idea of like co-producing, excuse me, results and yeah, that was really interesting. Also, I think yesterday they spoke about the intersection of like academic medical centers and churches, which is really interesting because like thinking about like caring for patients in the context of their culture and utilizing those community leaders who are trusted to carry out public health interventions is really cool.
Absolutely. Yeah. So it's been a pleasure. I mean, before I let you go, is there any one word you want to tell our viewers? Cognizant of the fact that you have to go make a presentation.
No, I think just keep plugging along. The fight is always there to fight, and just like collaboration is key. So yeah.
Absolutely. So thank you again. It's an honor hosting you today.
It's a pleasure.
And hopefully this will be one of many conversations.
Yes, thank you.
All right.